Thank you very much for coming and to come here to listen to a subject like brain death and that. But it's so very important that to learn this. What are we going to do? Well, first of all, I'll tell you about a couple of patients, and you'll be able to tune in on some of the difficulties that are encountered, and then we'll try to have some understanding about what what a person is and why we protect and preserve the life of the person, and then what it means to be a living person and how to distinguish the living person from the cadaver, a dead, the remains of someone. And then as we do that, we will get into dealing with things about brain death and organ transplants and how that fits into the system of death that we have. To begin with, some of you have heard of a patient by the name of Jahi McMath. Jahi McMath is now a 16-year-old girl who was, when she was 13, she was in California and went in to have tonsil surgery. It wasn't simple tonsil surgery, it was a more extended kind of surgery. And when she was in the recovery room, she hemorrhaged, she had bleeding. And that bleeding resulted ultimately in her stopping breathing, and she had to be resuscitated. And when she was after she was resuscitated, they said she was brain dead. And her mother said, "Oh, that's my Jahi, she's not dead." And the hospital said, "Well, we believe that she is, and since you don't believe it, what we're going to do is stop treating her, take away her life support." And her mother said, "No, that's my Jahi. She's not dead. Her heart was beating. She had circulation. She had respiration. This already, days had gone by. Jahi wasn't getting cold like a cadaver. Jahi was warm." So her mother got on the television and pleaded for someone to help her. My son was there and said, "Well, Dad, what are you going to do?" Well, between Jahi's mother and my son, what option did I have except call and get a plane ticket, which I did, and went to California. It was nighttime, it was dark, it was raining, and I had to rent a car, and the lady at the airport said, "Do you want insurance?" And I said, "No," because I always say no. And she said, "Don't you know where you are? This is California. You should take insurance." But I didn't, and got to the hospital, but they wouldn't allow any doctors in to see her. And so the way I got in to see her is her stepfather was about 20 feet from the guard, and I was 20 feet on the other side, and he said, "Oh, Pastor, come on in here." And that's how I got in to see Jahi. And the hospital at that time referred to Jahi as a dead body. They would not even call her by name. It was so awful for her mother to have to deal with that, and her relatives, her grandma and the like. But we did manage to get some things started to help her, and miraculously, a hospital in New Jersey said that they would take her. And so we got her transferred from California to New Jersey. Jahi has a death certificate in California. Since being in New Jersey, she's had her 14th birthday and her 15th birthday and her 16th birthday. And so she's very much alive in New Jersey. Recently, there was some news about her that a judge in California has determined that Jahi may not be dead. Well, let me tell you, folks, don't don't think that that mother's been taking care of a cadaver for more than 3 years. She's very much alive. Her mother says to her, "Jahai, give me a thumbs up," and her thumb comes up. Takes a little while. She doesn't do it rapidly. Raise your right leg. And she raises her right leg, and so that's Jahai, a recent patient. There are others. Alan was in Montana. He almost drowned on July the 22nd, more than a year ago. And his parents pleaded for someone to help, so I went to Montana, and we got treatment started and intervened in the court to get them to stop doing things to harm him. He went home from the hospital on December the 7th. I can remember that because it's Pearl Harbor Day. Went home on December the 7th. He is living at home with his mother and father and his brothers and sisters, and recently we've started another new treatment on him. Well, I'm a neonatologist. Some of you might know what a neonatologist is. Neo is the Latin word for new, and natal means born. So a neonatologist is a specialist in the care, in the diagnosis and treatment of newborn babies. In 1963, and I had been practicing a short time, but had finished my training a couple of years before, and many babies died. Fact of the matter is, I reviewed the statistics at 2 hospitals, and there were no survivors in babies 3 pounds and 4 ounces or less that had trouble with breathing. It was 100% mortality. So we started a special care nursery. We had no treatments. We had to invent the way to breathe for the little babies. Incidentally, the ventilator that's used for everybody is the ventilator that was invented for the little baby. And it was invented for the little baby because it had to be very sensitive, and had to be very precise and very accurate. So once the techniques were there for breathing better for little babies, those same techniques are used for everybody. It's the same ventilator, the ventilator that I'm used to using on newborns. It's just a matter of changing the dials and a few things, and it's useful for everybody. So the ventilator had to be invented. We had to invent new ways to do nutrition in the vein and lots of other things, and we were part of that. Well, I started that nursery in 1963. The word neonatology was not known, but what happened then in 1975 is I had a baby, Joseph, in the nursery, tiny little baby. He weighed less than 2 pounds when he was born. And he had trouble with breathing, and we were using the ventilator. And when he was about 5 weeks old, he was still on the ventilator, and he wouldn't take any breaths on his own. And a member of the team said, "Well, let's do a brainwave test." So we did that, and his brainwaves were flat. He had no brainwaves. And what was written on his chart is consistent with cerebral death. So I saw the report come, and I look at the report, and it says death, and I look at Joseph, and Joseph's not dead. So I called the neurologist. I said, "What are you doing, Harvey, writing this on his chart? Joseph's not dead." He said, flat brain waves, consistent with cerebral death. He said, I said, "Well, what do I do?" He said, "Well, get another one." So we waited 2 days, and 2 days later, his brain waves were still flat, unchanged from the previous one. So I said, "Harvey, what do I do now?" He said, "Well, some places stop the ventilator and stop treatment." And I said, "Well, I don't do that. I treat babies. Some live, some die." I continued to treat Joseph. And Joseph went home from the hospital. He went to school. He got straight A's. He ran track. He played baseball. He's married, has 3 children. So because of Joseph, I started to study the subject of brain death. The best word to describe brain death is the word mendacity. Mendacity is not a new word. It's not commonly used, but what it means is deception, a lie. Brain death is deception. It's a lie. And you get brainwashed. And the way you get brainwashed is you hear brain death and you think death. Brain death has nothing to do with death. Brain death has only to do with life. Everybody who's called brain dead is a living person. Everybody who's called brain dead has a beating heart, circulation, respiration, has a functioning liver and functioning kidneys, and many other aspects of maintaining the milieu is what we would call it, what's necessary for the tissues of the body to be able to support and sustain life. Life of the person is different from the life of lots of other things. The lots of other things we know about life that's in the plants and the flowers, and we know about life that's in the dogs and the cats and the cattle. But the life of the person is different, and you can remember some of the things that make it different if you remember the word live. There is a Latin word that goes along with it, viva. But remember the word live, and the L in live stands for the living, the existence. You can remember that, the living, the existence. And the I is for the intellect. The intellect is not intelligence. It's not what you measure, what's measured when they measure the IQ. But the intellect is the power of the soul. And the power of the soul is to search for the truth. See, us human beings can search for the truth. And then the V is like voluntary, and that's the will. And the will is to search for the good, the object of the will. Those are powers of the soul. And then the E is kind of like the word hearing with a silent H. And part of why I use that is because hearing is when we hear the truth. And when do we first learn this thing about truth and good and the like? We learn it when we're little babies, and we learn it from our mothers and our fathers. And it doesn't make any difference what language the mother speaks, whether the mother speaks English or Spanish or Chinese or whatever it is. The little baby understands the mother. The little baby understands what's true and understands what good. And so hearing, so you remember that. Now if you insist on using a Latin word, then it's viva. Vivendi means our existence, intelligendi, the intellect, and volendi, the voluntary or the will. And then the Latin word is audiare, which means to hear. So you see, we know what a living person is. We know because each one of us is a living person, and we know lots of other ways. We know from ourselves, we know from other persons. We don't have any trouble with that. Well, and while the person is living, yes, our brain is used to talk, used to hear, but our brain can't do anything unless our heart is doing it too. And our heart can't do anything unless our lungs are doing it too. And our heart and lungs and brain can't do anything unless our liver is doing it too. And our heart, lungs, and brain can't do anything unless our kidneys are doing it too. And so you see, the way the body works is that it's an interdependence of cells, tissues, and organs that maintains the unity of the body. The unity is the oneness of the body. It's in the human being, it's the unity of the body and the soul. It's the unity of the physical and the spiritual. And that unity is there from the time of our creation. And we know that creation has occurred at the time of conception. And so God created the heaven and the earth, and there's nothing new on earth except the person. And every person is unique and unrepeatable, and we know that person is there at conception. We can say that the person has arrived at conception. At conception, There is a unity of the body and the soul, and you have to use the word conception to designate that. It's not just biology, but because just biology has to do with what happens with the bull and the cow, and you get a calf. That's biology. But that's not what happens with the human person. God created the first persons without human beings being involved in that, but then he set it up so that all of human persons who were created after that, it's a cooperation and a participation in creation that goes in a very special way between God and the father and the mother, the husband and the wife, and brings that together. What happens following creation is preservation. Preservation follows creation, and preservation continues, and it's on, and for preservation to occur, there must be oxygen, there must be water, there must be nutrition, and the preservation includes exits to get rid of the waste products. So the waste product of breathing is carbon dioxide, so the carbon dioxide has to get out. The other waste products have to do with urine and stool. So to live on earth, we have to be created, and once we're created, a preservation is there, and life is a continuum from true conception until true death. Now, why do I have to put in true? Because words get distorted, and you have to use true conception. For a number of years, what they did is they tried to say that conception occurred when implantation occurred, when in fact that's not it at all. We know from biology and then from other studies that we can learn about chromosomes and DNA and identification of the person, and we know that the mother has DNA, the father has DNA, and when they come together, that DNA, which is the identity, the nuclear identity of the person, and the new DNA of the baby is different from the DNA of the mother and father, and we know that in the first cell that's there. So true conception and preservation follows, and life is a continuum until life ends. And when life ends on earth, it's the death. And we can know that the death is there because that once death is there, and we all know it. We know it from our experiences in life, whatever they are. They happen to be with our pet, or happen to be with our goldfish when we were a child. They happen to be when someone dies that we love, our mother, our father, or grandfather, and we know when death is there. Well, what's this thing called brain death? Well, what happened was that they wanted to do a heart transplant. And why they wanted to do a heart transplant is because they wanted people to live longer. So they said, let's get hearts from cadavers. So they took the heart after somebody died and transplanted it, but it didn't work. So they said, we have to do something different. And while they talked about it, Dr. Christian Bernard, who trained in the United States, but then went back to Johannesburg, South Africa, did the first heart transplant. And those of us who are a little bit older remember that first heart transplant happened on December the 1st in 1967. And there was news all over the world how this heart transplant is done. Well, hardly any of you remember when the second heart transplant was done, but I have to tell you about it, if for no other reason. We're here in Brooklyn. Where was the second one done? It was done in Brooklyn, New York, at Montefiore Hospital. And who did it? Dr. Kantrowitz did it. And what Dr. Kantrowitz did, and when I used slides, and we would use slides, but it's just not so convenient to do it, and it's in a church. And so out of respect for God and the church, and time and lots of other things, we don't use slides. But one of the things I do, and I have in my slides to show you, is the little baby in Brooklyn, New York, who is packed in ice because they transported him from Philadelphia to Brooklyn to do the heart transplant. And they cut the beating heart out of a 3-day-old baby and transplanted it into an 18-day-old baby. And at the end of that time, both babies were dead. They killed 2 babies, trying to show how great they were in transplanting a heart. They were willing to take the heart out of a heart that was normal and out of a living baby, but he had something wrong with his brain. Therefore, his life was not worth living, and we could cut it out. It could be cut out and given to an 18-day-old baby who has more claim on his life. Well, what happened is that was in December of '67. So in January of 1968, a committee was appointed at Harvard, and the committee was appointed to invent brain death. And they reported in July, in just a few months. 13 people got together, all men, no cardiologist, no family physician, doctors who were interested in making this happen. So the committee got together and invented brain death and reported in about August of 1968 a definition of irreversible coma. Coma is close to the word comma. It means a pause. Everybody who is in coma is alive, and so everybody's in coma is alive. These babies, the person that they took the heart from in South Africa was alive. The baby in Brooklyn was alive. And so they had to find a way to get organs. And so the way they got the organs, you can probably still hear me, can't you? The way they got the organs was they invented brain death. Brain death has nothing to do with death. Brain death is brainwashing. It's in some ways it's analogous to life insurance. Life insurance has nothing to do with life; it only has to do with death. But the person who sells life insurance would have a hard time selling death insurance, and so it's like that. So brain death, you hear death and you think death, and no, it's alive. Everybody who is brain dead is a living person, and it's set up so that they can get organs for transplantation. Now, death is different from being alive, and you can tell the difference that when the life goes away, then what you have is the remains of someone, and the remains of someone doesn't have any beating heart, doesn't have any circulation, doesn't have any respiration, doesn't put out urine, doesn't do anything, because it's the remains of someone, and it's clearly different. The living person is different from the person who's dead. And so what they wanted to do was to get hearts and other organs for transplantation. So they invented brain death. Brain death is not based on any kind of scientific studies that would be valid for any other purpose. The Harvard committee did not do any studies on dogs or cats or rats. Didn't do any studies on human beings. The only thing they did was just published it and said, this is a new way to declare death. And it's called a definition of irreversible coma. And that was in 1968. And then the next article was 1971. It was the Minnesota criteria. They studied only 9 patients, and 2 of the 9 still had brainwave activity, and then they concluded no longer do we have to look at brainwaves to see if they're in this matter of brain death. A lot of people think that brain death means flat brainwaves. There's no obligation to do brainwave testing. A lot of times they do, but there's no obligation to do it, and that obligation was removed already in 1971. And then the largest study in the literature is a report on 500 patients, and 44 of them didn't die. And of those that did die, they looked at the brain at about half of them, 226 to be exact, and 10% had nothing wrong in the brain. There was no pathology in the brain. And then they called their data, called it the NIH criteria. Incidentally, between 68 and 78, there were 30 different sets of criteria published. Every one gets less strict than the previous one. And there are more sets since that time. And they published in 1977, these criteria are recommended for a larger clinical trial. It's never happened, never will happen. Why? Because the purpose is to get organs. And they get organs. And where do they get organs for transplantation? From people who are called brain dead. And then when they couldn't get enough, what they did is invented this thing called heart death. And what heart death is somebody who has obviously a brain activity, but they want their organs. And so what they do is they get a do not resuscitate order. Remember this, folks, you should never give a do not resuscitate order. And the do not resuscitate order then amounts to not using lots of different treatments, not just using CPR, cardiopulmonary resuscitation. In fact, is sometimes when I deal with this question of do not resuscitate, they're already on a ventilator. So it's not a matter of that kind of thing. And so the answer to that part, remember, and I'm only going to ask you to remember a few things, but one of them is do not give a do not resuscitate order. What happens is that somebody who has something wrong with the brain, but they have brain activity, but they want their organs. So what they do is they get a do not resuscitate order, and then they take them off the ventilator. And then they watch what happens, how fast the heart rate goes up, what happens to their breathing, and then they put in another part in the equation, their age, and then they take them off for 10 minutes. So it's after 10 minutes of suffocation, see what it is, and then they have a score. It's called a Wisconsin score. And from that score, they predict that when they take them off a ventilator again, in 30 minutes or 60 minutes, they'll be without a pulse. Listen to me now. I didn't say without a heartbeat. I said without a pulse. When they're without a pulse, that is when they're without a heartbeat strong enough to cause a pulse for 2 to 5 minutes, depending on where you live, it will be, and that becomes the signal to cut out the beating heart and the other organs. That's what heart death is. And then where do they get so many of the organs now? They get it from overdose of drugs. Overdose of drugs. There's 8 deaths a day in Ohio. All over the country, there's deaths occurring because of overdose of drugs. And one of the things that the Harvard criteria, the committee said, is there can't be any drugs in their system that would depress their nervous system. And yet they get more organs from overdose of drugs now than they do from accidents and gunshot wounds combined. It's big business. How big is the business of brain death? Even I can't get louder than that noise. How big is the business of brain death? It's a multi-billion-dollar industry. I'm making it difficult for the recorder here, but that's okay. I know why I do this. I make it easier for all of us because if the best way I know to put somebody asleep is start talking and sit still. So I move around a little bit. So what the Harvard criteria, they had certain caveats that you had to exclude. In those days, they excluded infants and nobody under the age of 12. They excluded anybody whose temperature was down, no hypothermia. They excluded drugs. What do they do now? They take them because of drugs. Can you test for all the drugs? No, you can't, even if you want to, because they don't even know what the drugs are on the street, lots of times, combinations of them. And so what they do is and so what's the campaign now? the campaign is to get Narcan into the hands of every policeman, everybody, so they can do this. And they want them to counteract the drugs. Yeah, counteract them enough so they don't die on the street, and they can get into an emergency room where they can get their organs for transplantation. How big is the organ transplant industry? $24 billion was billed in 2014 for organ transplants. It's a multi-billion-dollar industry. It's larger than the abortion industry. And the brain death, which is necessary to get the organs, is the root of the culture of death that we find ourselves in. The culture of death is a system of death. And the system of death is run by the federal government. The way that the medical system runs now is that, and you hear these things about repeal and replace, but what I'm going to tell you, you haven't heard. I'm pretty sure you haven't, because they don't want you to know this. But the way the health system is set up is that under the Obamacare, the Secretary of Health is who determines whether you get treatment or don't get treatment. Yes, the Secretary of Health has lots of people under them, so and that kind of thing, but the Secretary of Health has the final say-so about whether you get treatment or don't get treatment. And the final say-so, if you have, it's called CMS, which is Medicare and Medicaid combined, and you say, well, I have private insurance. No, folks, don't kid yourself. The private insurance companies follow exactly what the Secretary of Health says. You know why? They don't, they won't be in business either. So it's a healthcare system that's run by the Secretary of Health, and the arguments that have been going on in the House has to do with whether they're going to allow this to continue, that the Secretary of Health determines if you get treatment or not, or whether some other system ought to be there to determine if you get treatment or not. And you don't hear any of this. All you hear about is how the money is going to be changed, and then now the latest thing is how there's going to be more of the money given to the states. Come on, folks. Let's not kid ourselves. If you think that health care is going to be different in New York than it is in New Jersey and Pennsylvania, you're kidding yourself. Just because you have a different governor and a different Medicaid system and the like, it's all still run, and it's a socialized medicine that we already have in the United States, and then we have people campaigning for a one-payer system and that kind of thing. It's not good. So what kind of health care should you have? You should have a patient-centered health care. It's the patient who gets sick. It's the patient who needs treatment. And the patient goes to the doctor, and you ought to have a doctor, or at least a doctor's representative, to determine whether you get treatment or not the Secretary of Health. What is this? And we sit around, we're citizens in the United States, and we sit around and let this thing go on. And so anyway, I'm telling you about brain death. I'm telling you about the system of death. And so what are you going to do about it? Well, first of all, you should realize that when you go to the License Bureau, they ask you, do you wish to be an organ donor? You should say no. That's the first thing. No one should be an organ donor. And they ask you a question, and they give you no information. They don't tell you about it. They give you no information. And you say yes or you say no to it. When you come out of there, you don't know what you said yes or say no to. And then you see, there are three verbs that follow each other. You may, you should, you must. And you must have to do with the laws. The law is set up to make you dead when you're alive. That's the determination of death law. And then it's set up that everyone is an organ donor, at least in 47 states. It's presumed that everyone intends to be an organ donor. It's presumed that everyone has consented to everything to be done to them to get their organs. And that's the Anatomical Gift Act. And then, does anybody know the title of Obamacare, the official title? Anybody know another name for Obamacare?
Affordable care.
Affordable Care Act. Is that the name of it? That would be ACA. But the initials are PPACA. That's what that act is. You've never heard it. See, you're not allowed to hear it. What it means is Patient Protection Affordable Care Act. The first thing is, everybody has heard multiple times, there's nothing affordable. There's no patient protection in it either. It's the same brainwashing. It's the same brainwashing. They tell you things and they're not true, and then you start believing them, and here we are. We're in this system of death that's run by the federal government. It's part of the socialized medicine, and it's part of being able to kill you to get your organs so we can give them to somebody else that's more deserving of them than you are. And who's in the greatest jeopardy? The people who are between 16 and 40. That doesn't mean it excludes the rest of us. What's the oldest organ donor that I've read about? 91 years old. They said, well, his kidneys are still good, and we can give them to somebody else. You know, in the organ transplant industry, they have Class A organs and they have Class B organs. The Class A organs come from the motorcycle accident who's not on drugs and happens to be 20 years old. The Class B organs are somebody who might have HIV, but it's in no evidence of it now. And then this other person who is desirous of an organ says, well, if it'll save my life, I'll take it and take my chances. Here's what, God set it up so that we can't transplant organs from one to another. Why? Because we reject the organs from one to another. There's a rejection system that's built into all of us. And now, does God know anything about stopping rejection? He certainly does. When does he stop it? When a mother is pregnant. When a mother is pregnant, she does not reject her baby. Her baby is foreign to her. Remember about the DNA? It's not her DNA. It's the DNA of her offspring. And it's different, and she rejects it. She won't take it. But there is an early pregnancy factor that goes to work already when there's just one cell, and that's before implantation, and it stops the rejection system in the mother. Stops it in the mother. God builds it in, but he builds it in during pregnancy, no other time. He makes it so we can't transplant organs from one to another. So God's way is no transplantation. And so now another thing that you need to learn while we're here, you need to learn about the difference between the words ventilator and respirator. Ventilator means to move air. If there was a fan blowing, we would call that ventilation. And there is, but we didn't turn it on. Well, you never know. I tell you. Oh, it's a plug, but where does it go?
Do you want it on?
It's all right.
I can put it on.
What?
Is that a plug?
Right here.
You see what happens. See, there's a difference between men and women. I saw the plug, and I was willing to give up. But the woman, she's going to find out how to make that fan work. So you see, that fan is providing ventilation, not respiration, ventilation. The machine that we use when a patient is sick and needs ventilatory support is a ventilator. And the only thing the ventilator does is pushes the air in. That's all it does. Everything else occurs because the person is alive. You see, the air can get pushed in, but the oxygen has to get from the air into the blood and the lungs, and then that blood that's in there has to get circulated, so the heart has to be beating with circulation and deliver the oxygen to the tissues where the carbon dioxide is picked up and then carried back to the lungs, and then the carbon dioxide goes out. But the ventilator doesn't push it out. It's the living person that pushes it out. You see, I was looking for a rubber band. Sometimes I have one, but I don't see one there. But you see, if we had a rubber band and was laying on the table, this isn't doing anything. Well, we know if we stretch the rubber band, and so you see she gives me this rubber band and it's not doing anything. So we stretch it. Now you and all of us know that if I let it go, it's going to bounce back, huh? So what makes it bounce back? What makes it stretch out? Well, you know I stretch it out, so you know I'm the one. Well, I don't push it back. How's it go back? Because it has elastic properties. And elasticity is a property that stores energy, and then they're released at another time. That's what the rubber band does. The way the body works with you and me and the patient on the ventilator is that our body uses the muscles of the chest and the muscles of the diaphragm contract, make the chest get bigger, and air goes in. Well, then what happens is that the chest wall and the diaphragm and the lungs store energy. So that energy is stored, and so at the right time, it contracts and pushes the air out. So the ventilator only pushes it in, and it only works, the 4 phases of breathing. The other 3 all occur only because the person is alive. So you have to learn that difference between ventilation and respiration. Ventilation is the movement of air. Respiration is the oxygen going in and carbon dioxide coming out. The same term is used for ventilator and respirator, but the correct term is ventilator, not respirator. Now, another thing you have to know about brain death. What brain death is the patient is unconscious. And then there are certain reflexes, brainstem reflexes, the shining light in the pupil and the pupil doesn't respond, touching the cotton to the cornea and the patient doesn't blink, putting ice water in the ear and the eye doesn't move. There are 14 brainstem reflexes, but they test only 6 of them. The cough and the gag's another one. They test only 6 of them. And then, what is the final say-so about brain death? That is whether the patient can take a breath or not on their own. And the way they do it is the patient's on the ventilator, and they take the ventilator away for 10 minutes. For 10 minutes. Now, they fool the people by saying, oh, no harm will come because we'll give you extra oxygen. We'll give your sister extra oxygen. We're careful. We care a lot. They don't tell you that breathing is more than just oxygen in. It's carbon dioxide out. So it's like putting a pillow under their face, over their face, that makes them so they can't get carbon dioxide out. And when carbon dioxide can't get out, it goes up, and with it, acids go up, and increasing carbon dioxide and acids makes the brain swell worse. It makes them get worse. It makes them get the condition that they're looking for. It makes them get a less functioning brain. So everybody has to remember, no, no, no to the apnea test. Now, what are you going to do about this? Well, I'm going to give you a booklet to take with you because it tells you a lot of these things, but it has a card in it. And this card is called a medical opt-out card. Other people named it. We put together the card, but it's a medical opt-out card. And what it says is, I wish to be treated. That's the first thing. I wish to be treated. And then it says, I want to get food and water. Of course, I can't write down food and water because the law uses words like nutrition and hydration. So I want to get food and water. I want to get fed. I want to get water to help me. And I don't want you to take any organs for transplantation. And I don't want you to do anything to hasten my death or to shorten my life. That's what the card says. And you need to take that. It needs to be signed and witnessed. And then this booklet has information in it. The last 2 pages are just like the card, except you can get it notarized. Now that's so you need to have the card, and then you need to have a power of attorney. What happens is that when you get to be 18, then you've reached the age of majority, at least in many places, if not most places in the United States. And when you reach the age of majority, when you get to be 18, they don't look to your mother and father for permission to treat or not treat. And so they go to the court, and then the court appoints an attorney to be the guardian. Not too long ago, there was a little girl, Miranda, in Virginia, a 2-year-old girl who choked on popcorn. And the court appointed a guardian for her. She had a mother and father who loved her. She had 5 brothers and sisters. The court didn't appoint any of them, but appointed a guardian. It was so awful in the courtroom to see the judge look to this other attorney when the father's there and their brother and sister was there, not look to them about what they should do or not do about the treatment of the little girl. It was so awful. So when you get into the system, it's not always there for you. So you have to have a power of attorney. The power of attorney is in this book, and this power of attorney is somewhat different from most of the other powers of attorneys that exist. This power of attorney is there to protect and preserve your life. You have to sign it and witness it, and then if you have someone who is dependent, that can be a child, it can be an older person. If you have that you need the power of attorney for that. So all of that's in this book. Now I think I've pretty well covered the things that I would cover if they were in the slide. But you see, if I did the slides, you would be able to see them. The transplant, how the transplant begins by opening the chest. They make the incision from the neck all the way to the pubis, and then they open the chest, and you'd be able to see the chest open up, and you see the coverings around the heart. We call that the pericardium. When they open that, you see the beating heart. Everybody who has brain death declared on them has a beating heart, and the transplant surgeons see that, and they pretend that doesn't count. That someone is dead when in fact they're very much alive. And you see, brain death, the declaration of brain death, which is a lie, however they do it, is the signal to do something that makes death happen. What they do is they cut out organs or they stop treatment. Okay, questions, comments? You'll be able to have the book to go home with. Yes. Now, my hearing's not good, so I hope you'll be patient with me. Sometimes what I do is ask people to write the questions, and we can maybe do that there, and even that, yeah, even that might not help, but you can try.
I don't know, well, I do speak kind of loud, but I will, can you hear me? Okay?
Yes.
Hopefully, go ahead.
Well, my name is Rosa. And,
Rosa. My name is Paul, Rosa. I'm very glad to meet you.
Me too.
Rosa.
I read a little bit about what you said, and my daughter's a nurse. And
Who is a nurse?
My daughter.
Your daughter, yes.
And every time I try to explain to her that brain death may not always be brain death, she kind of yells at me because she says, I am a nurse, I am in the field of medicine, and anybody that is considered brain dead never comes back.
Yes.
That's what she says.
Well, first of all, I'm happy that your daughter is a nurse. Furthermore, she better agree with everything and anything that's going on, or you know what will happen, don't you? She won't have a job. She knows that, and so do all the other nurses know it. All the doctors know it too. But she knows that there's clearly a difference from the patient who gets wheeled into the operating room with the beating heart and circulation and comes out without those organs, and there's no movement, there's no circulation, there's no nothing after they take the organs. And she's right that the majority of patients don't survive after the declaration of brain death because they do something to make them dead. Now, I just told you about Jahai. Jahai had 3 neurologists in California before I saw her, and she also had a consultant neurologist from Stanford who came to see her. And not only did they all agree with the examinations that she was brain dead, but they did a technetium scan to technetium is an ion that they check for to see if there's circulation in her brain, and she had no circulation and no evidence of circulation. See, and I just slipped it by you there. No evidence of circulation does not mean no circulation. It means that the system doesn't detect the circulation. But Jahai had to have circulation in her brain. And how about Alan? Alan, the little boy I told you about, who almost drowned, and then we got involved, and they had already done that terrible apnea test on him, but we stopped them from doing it again and got treatment started. You see, when the brain swells, it doesn't make thyroid stimulating hormone, so the patients get deficient in thyroid. So all of the patients that have this swelling of the brain have hypothyroidism, and hypothyroidism makes for more swelling. And so they have the swelling of hypothyroidism, which compounds the swelling that they have from their brain problem. And so you see, we know that with the patients, if we give them thyroid hormone and other things that they need, and we give them nutrition, they don't die. They continue to live. And what is my golden objective? My golden objective is to help people to know that brain death is a lie. Everybody who's brain dead is alive, to help people to know that. But it's somewhat like the field of neonatology. When I started to do neonatology, every baby less than 3 pounds and 4 ounces died. I reviewed the statistics at 2 hospitals in St. Louis, and every baby died. It was 100% mortality. And when I started, they said, "Oh, come on, Paul, you know they can't metabolize protein. They can't metabolize glucose. You don't have a ventilator. You know it doesn't work. What are you doing?" I said, "Well, I don't really know, but it seems like we ought to be able to do something." And that's how we started. And everything else that you see in neonatology, and much of what happens for adults, all the adults on ventilators come from an infant ventilator. When you get your blood drawn, they draw a tube of blood, but they just use a tiny bit. It's microtechnique. Why did microtechnique come about? Because a 2-pound baby only has a tiny bit of blood, so we had to have a microtechnique for the 2-pound baby, and that's what's used for all of us. They throw away most of what they draw from us because they don't need to do that. All of that comes, why does it come? Because other doctors and myself said there ought to be something we can do, and that's how we started. It's the same way with brain death. It's the same way with other things. When people get very sick, medicine is exciting when we do CAT scans and MRIs and operations. It's exciting, and I'm happy to be part of it. But what do they do when you get very sick? They send you off to hospice, and then you have to know that they have now a thing called palliative care. And palliative care has nothing to do with treatment. If you're lucky, you get care. It's comfort care. It's to make it so that you don't get treatment, and then what happens, we will take care of you, because when you get close to death, we will give you medicine to give you comfort. And yes, you will die, but that's okay. You're going to die anyway, kind of stuff. That's palliative care. The word palliative is rooted in the word Paul, P-A-L-L, Paul. And you know that when there's a funeral in this Mass, the coffin is brought to the door. The priest meets the coffin at the door, and he puts a cover over the coffin. And what's that called? It's a pall. That's what it's called. And do you ever hear of pallbearers? Pallbearers, none of these have to do with life. And now a pall is also used in the Mass, because the card of the Mass to cover the chalice is called a pall. So pall means to cover up. So palliative care, what are they covering up? And this is all part of the system of death. You're next.
I just have like 2 questions. Is it okay to donate your own organ, like if I need a liver and I ask my family member for a liver, is that okay? Is it, because you said you can't share
you want
organs.
You want my liver?
Sure.
No, you can't have my liver. Why can't you have my liver? because the only way you can is to transplant liver, whole liver, is to kill the donor. And the teachings of the Catholic Church are very clear about this.
No, I mean, if you're alive though, like, you know how people,
You see,
or like you're,
when they do the kidney with the so-called live donor, a few years ago in Colorado, there were two brothers. And so they took part of the liver out of one brother and gave it to the other one. And the brother that they took the organs from died in a few days. And the recipient of the organ died in about 6 months. And that was supposed to not happen. Then they looked into it and they found 5 others. And so they don't do very many of those anymore.
oh, I meant kidneys.
Okay, we're going to come around to kidneys, but I think I heard liver first, so that's why
But I thought, like, you know, people.
yes, I know. They hear about that. Give a kidney. Yeah,
But they
give
still
a
live,
kidney.
Both of them live. I mean,
Give a kidney. Now, here's what you need to know. It isn't just a kidney that's transplanted. It isn't just a heart that's transplanted, but because you can go to the butcher market and see in the display case, you can see the kidney. Is it any good for transplant to another cow or another pig? No. Why? Because it's without life. You see, the heart has to be with life. The liver must be with life. The kidney must be there with life. It cannot be dead. Then to give a kidney, the teaching of the church for centuries has been that you are not to kill yourself, you're not to harm yourself, you're not to mutilate yourself. And to cut into somebody to get a kidney is mutilation. That's the first thing. Furthermore, the studies now show that the ones who give one of their 2 kidneys, they show increased incidence of heart disease in those that they give the kidney. So there's some reasons to be a little bit concerned about that transplanting one of 2 kidneys. Is that to be expected? Of course it's to be expected. Why? Because the heart is this very special organ. The heart has its own brain. It has its own nervous system. The beating of the heart is intrinsic to the heart. It doesn't need the brain for the heart to beat. And it makes the heart beat, and then not only does it make it beat, it makes it stop beating. All of that's in the nervous system of the heart. And the heart has its own endocrine system. What is an endocrine system? An endocrine system is when an organ makes something, and then through circulation it takes place in another organ. So the heart has its own endocrine system that makes a chemical that controls our blood pressure. And so when the heart makes chemicals for 2 kidneys, and then you take one away, extra chemicals than what that person who donated the kidney doesn't really need to be doing, but continues to do it. So at least that's some explanation. I can't tell you that that's factual, because I don't know that, but it makes sense to me that you can't take one kidney out and think that there's not going to be some repercussions and some problems with it. So at least for me, I would have to say no for me and anybody that I was responsible for. And it's some of those things that there are some things you just can't do. And even if everybody else is doing it, and St. Augustine said, wrong is wrong, and right is right, and even if everybody's doing it, it doesn't change those kinds of things. And it's kind of like that. So you see, we as Catholics believe that we shouldn't kill people, we shouldn't harm people. We believe that contraception is evil, and we don't participate in it. And while it's part of the teachings of the Catholic Church, the teachings of the Catholic Church are based on the Bible and based on things that you can figure out, and some things about the Blessed Virgin. I'll share with you. I'll go sit down if you don't mind. I'll tell you a little bit of something about the Blessed Virgin. It's kind of off just a little bit, and then realized that it's Paul Byrne saying it. It's not the church, but here's what the teaching of the church for a long time is about the Immaculate Conception, and that Mary was conceived without sin. Well, you know what? From a biological point of view, Mary had to be conceived without sin, because Mary was going to provide the egg for the incarnation of Christ, and that egg had to be pure. Well, you see, all of us are born with sin, and then we get baptized and get rid of that. But they couldn't wait for Mary to be baptized. She had to be conceived without sin, because a girl has all of her eggs by about 6 months after conception. So before a girl is born, she has all of her eggs that she'll ever have in her whole life, and then when she reaches puberty, 1 egg a month ripens. But she had her eggs, so Mary had to be conceived without sin, so that she would have a pure egg for the incarnation of Christ. And of course, God knows all of this, and he knew all of this when he created the world, and when he created Adam and Eve. He knew he was going to have Mary and all that kind of stuff. So it's not there that Mary is conceived without sin because of what biology finds out years later. It just confirms that can be. Another little part about Mary, so that you can put together about the Assumption. You see, when a baby is inside of his or her mother, we said that the circulation and everything was separate. Well, what's happened in the transplantation industry is that they look at the liver and make slides of it, and here's this female, this lady that they have, they're studying her liver, and there's a male cell. And there's another male cell. Well, where do those male cells come from? They came because she had a boy baby. And our techniques allow us to identify male cells amongst female cells. And so every mother who's had a baby, she has some cells from her baby. And every mother has given some of her cells to her baby. So you see, Mary gave some of her cells to Jesus, and so and Jesus gave some of his cells to Mary. And yes, Jesus ascends into heaven and Mary is left on earth, but all of Jesus needs to get into heaven, so Mary had to be assumed into heaven, so all of Jesus is there. So it's just a little thing. It's not the church teaching. It's Paul Byrne just putting his little knowledge about the few little things that we learn about life and see how they apply. And the things that I've told you about the cells, that is science. And what happens in science is we discover what God has done. And science finds all these things, but if it's contradictory to what we know, there's something wrong. It's just like brain death. It's common sense that you know the difference. Well, just because a person is an expert in neurologist and they're trying to tell us that somebody is dead, like telling Jahai's mother, 4 super duper doctors couldn't tell the difference. And then what do we have? We have a philosopher, a lawyer who gets on television and now with the recent things and say, well, yes, the judge ruled that Jahai may not be dead. I say, go look at her and you'll know she's not dead, judge. But the attorney philosopher gets on TV and said, well, we got to really check this out because this would be a first, and every doctor ought to go examine Jahai. I'm going to tell Jahai's mother, no, don't let any of those doctors examine Jahai, because you don't need a doctor to examine Jahai to know that she's alive. Just ask any one of you. When she has a death certificate in California, you'd certainly know that if she was dead 3 years later, she'd be stinking. She's not stinking. In fact of the matter is, when I show the slides, I show a picture of this hand with this bracelet on it and holding Jahai's hand like that. And you can tell which hand is Jahai's and which hand is mine. And this bracelet is on there. Why did I take that picture? I took the picture because her mother showed pictures of her fingernails all decorated nice, like teenage girls have their fingernails decorated. They said, well, how do we know that that's Jahai's hand? That's what they said. So that's why I took mine. Now, if you can believe it's my hand and that's her hand, I can tell you. And what does this bracelet say? It says, Jahai is alive and prayer works. When I went to see Jahai after she was transferred, and her mother gave me this, she said, that's what you told us when you came to California to see her, that Jahai was alive and to pray and prayer works. And so Jahai is very much alive. Okay, now, so somebody have some more questions. Yes, hang on a second.
What do you think about artificial organs? And are you optimistic?
I'm not very optimistic, but that's me. That doesn't mean you shouldn't be optimistic. Part of why I'm not optimistic is because you've got a lot of play these days on pigs organs. So when were they trying to do things to pigs? It was when I was a medical student. Incidentally, I went where I was on Friday. It was our 60th class reunion. So 60 years ago, we heard about these pigs that they were going to make suitable for human beings, and it hasn't happened. Pig valves have been shown to be useful. So I'm not very optimistic. And then I have an advantage over a lot of people because I've done a lot of things. And one of the things I've done is I've looked at the placenta of every baby that I've been in attendance at birth. I looked at every one. How many? Thousands that I've looked at the placenta. And the placenta, they theoretically just throw away, but they really keep it and make makeup out of it and other things like that. But in any event, I've looked at the placenta, and every placenta that I've looked at, every placenta, no exceptions, the artery goes over the vein. The artery goes over the vein. So it's a very precise thing. It isn't just something that's discarded. It's a very precise thing. And then if you look at a kidney, you can slice the kidney that you get at the butcher shop and see the different parts of it under the microscope. There's miles of collecting tubules and that kind of thing that's in there. So to think that you can manufacture a kidney, I suppose it's possible, but I'm not very optimistic that it's going to happen. I think it's pretty sophisticated, the development of even an organ. Incidentally, that was one of the things in our arguments that we presented historically against brain death, is that with the things that can be done with DNA, there isn't any reason that we couldn't encourage them to develop in a new brain after somebody's brain is destroyed. And most people that get involved with this acknowledge that that's a possibility. And of course, if you see, the teaching of the church is that the life is in all parts of the body, all parts, and all organs, all cells, tissues, and organs. The life is in every place. Well, you see, if you make the life be in the functioning brain, then you're separating the head from the rest of the body. And not only that, you're separating the brain from the rest of the body, because all the rest of the body is going okay when the brain isn't functioning. And so it just doesn't make any sense, and it doesn't measure up to the historical teachings of St. Thomas and St. Augustine and Duns Scotus and a number of others. And so how we got into this, I can't tell you exactly, but I can tell you some of it is that, you see, some people would say, well, they needed organs for transplant. I say, no, they desired to have organs for transplant. And desire is a different word from need. Desire, by the way, is rooted in the Latin word liber. And so liber, L-I-B-E-R, and what words do you hear commonly? You hear liberty. is a Liber word. And so what is liberty? Liberty is putting together two Latin words, liber and arbitrium. Liber and arbitrium, so you get liberty. In Latin, the words are often reversed. So liber is desires and arbitrium is mastery as a word. So you reverse it. Mastery over desires is liberty. That's do good and avoid evil. That's different from freedom. Freedom is different. You see, liberty is an inalienable gift that comes from God. Freedom you get from man. You can rent an apartment, and in that apartment you can eat there, sleep there, have your friends there, but you can't raise chickens. The landlord wouldn't like it. Could the landlord give you permission to raise chickens? Yeah, he could, if the rules and regulations of the city would allow you to raise chickens in the middle of the city. You could, he could give you permission. You see, freedom comes from man and liberty comes from God. And where else do you hear the word liber? You hear it in liberal. And of course, they want you to think that liberal is a relative term. Relativism is part of how we're into this society that we're in. That liberal is a relative term. What is it relative to? To conservatism. Well, what's the difference? Liberal is rooted in the desires of man. One of the attributes of God is conserve. That's an attribute of God. There are four attributes of God: our existence, conserve, concurrence, and governance. And human beings have those attributes of God. And so to be conservant is to be godlike and to take care of what you have. To be liberal is to make according to the desires of man. And they're different words, but they rooted in the same thing. Okay, yes, sir.
I'd like to ask you two questions. I'll start with the easier one, which is, if you've already filled out an organ donor card,
Wait a minute, go ahead.
will the opt-out card work for us?
Well, it worked for you. The answer to that is an attorney can tell you, and I have learned a lot about attorneys over the years. I have a son who's an attorney, and when I get together with him and his attorney friends, every now and then I have to remind them that they can't get by with that stuff around me, that we stick for the truth. Oh, who said that? Anyway, attorneys have ways of making arguments. And so the opt-out card, I've shown it to multiple attorneys, and they have said to me, it seems like it will work. They know that ultimately things that go to the courtroom have to do with arguments, and sometimes it depends on how clever the attorney is and how it will work. But it's the best that I know, and it didn't come easy. We worked hard, and we did have input from a number of attorneys, but I won't blame the attorneys for the card. I will tell you that this is what we think is the best that can be done. That's number one. Number two?
Number two is a daring question here. We have heart transplants that have been successful.
Wait a minute, we have what?
Heart transplants that have been successful.
Yes.
The likelihood of a brain transplant
Yes.
being successful.
Okay, the answer is we have heart transplants that are successful, but how do you measure success? Every heart that's transplanted is a heart with life. It's a living heart. The donor is always killed, every heart transplant. The recipient of the heart, sometimes they die quickly, sometimes it takes longer, but they all have to have the anti-rejection medicine. But it has to be a healthy heart, and it has to be a heart with life. So are they successful? Of course, there are some heart transplants that if you measure success in a year, measured in 5 years, the numbers go down, but there will still be some that will do pretty well. So what do we do with that? We're excited for that recipient. We want them to live, but we know somebody had to be killed, and we don't think that's right. And I suspect that most people, if they're given the information, they will come down on the subject where I've come down. You're not given any information. You are not allowed to have information. You're not allowed to hear what I say, except in a place like this, or if the Right to Life people invite me and give me a chance, then I can teach people. But I want you to not only learn something here tonight, but I want you to do something about it. I want you to fill out those cards and carry them and get more for your family. And I want you to have a power of attorney. I want you to have it in place. And I hope that you always stay healthy and well and don't need it at all. But I want you to do something. Then I want you to learn no to the apnea test. I want you to learn no to the do not resuscitate. There's no question about these things. The answer is no. You know, it's difficult sometimes. Sometimes the most difficult thing that a parent has to do is to tell their child no. And you do that, and eventually, sometimes the child says, well, so what? I'm going to do it anyway. Well, they come to the time when they have to do that out of my house, not in my house. And so there comes a time like that, and it's not easy to be a parent. Anybody who thinks it's easy to be a parent, they probably have never been a parent. And by the way, we have 12 children, and we have 35 grandchildren and 5 great-grandchildren. And it was interesting. In our first 6, we had 5 boys and a girl. And somebody asked me one time, is it easier to raise boys than it is girls? And I said, well, in our family, it was easier to raise girls than it was boys. And one of our daughters heard it and said, yeah, Dad, that was because the boys taught us all the things we shouldn't do. One time, one of the children asked my wife, said, Mom, if you had to do it all over again, would you have 12 children? And she said, well, without batting an eye, she said, yes, but I don't know if I'd have the same 12. Anyway, we had a lot of fun, and still do. And so I was in St. Louis, and 5 of our sons lived there, and I saw 4 of them, and then one of our daughters from Kansas City came, so I got to see them over the weekend. So most of the time they still talk to me. Every now and then there's certain little things, oh my goodness sakes, little things that go on between brothers and sisters and that kind of stuff, and I just watch. Okay, any other questions? Yes?
I have a lot of questions, I hope you don't mind, but I have just a couple of them. One is I'm going to make a statement. From what I understand, once you sign on your driver's license that you're an organ donor, it goes to the federal registry, and it's impossible, almost impossible to get you off that. So I know that much. But also now we are finding 2 things that are going on in our society which are very worrying. And one of them is assisted suicide, which seems to be that all you need is 3 doctors, okay, and they can say that you're dead, and I guess after that it's up to your family if you're going to be an organ donor or not, if you don't have a will, of course. And the third is really kind of disturbing. I'm not sure that I should ask whatever, but you know how now they were saying, I read, that they're trying to transplant a womb into a man so that he can have children, you know, for transgenders. Now, are women at risk of being killed? Now, in order to get the womb, I mean, they got to get the womb someplace.
They get it from a living person. You can't transplant a womb. I didn't answer your head transplant. I'm sorry. I will go back to it now. She reminded me. I'll try to deal with what she asked. The first thing that she asked is about the license. When you record yes, it gets recorded, but each state has its own recording. And then the Anatomical Gift Act does have something in there that you can have a document of refusal, so that if you have signed up to be an organ donor and you realize tonight and sometime that that's not what you want to do, you go to the License Bureau and revoke that. So the law says that's a revocation, but a revocation is not a refusal. You still have to have a document of refusal, and that opt-out card and what's in this book is a document of refusal. Now, so far as assisted suicide, all of those are play on words. Physician-assisted suicide, no, that's doctor-imposed death. That's not assisted suicide. Suicide's when somebody kills themselves. And we have lots of examples when somebody is attempting to do suicide, and other people, policemen, firemen, do things to stop them from that. And I've never heard of a policeman pushing them off the bridge. I mean, that would be assisted suicide. Okay, and so Dr. Quill, who's from this area, read an article about him. He said, no, it's not physician-assisted suicide. It's physician-assisted death. He says PAD, not PAS. PAD is what he says. So you see, somebody that Dr. Quill were very suspicious of and concerned about, he sometimes writes some very beautiful things. If you read what he writes and you find something there that might help us. And what happens? See, people are not all good, and people are not all bad. And so we have to look at the good things. So physician-assisted death, doctor-imposed death, that's wrong. You should have nothing to do with it, even if it's legal. St. Augustine taught that. Even if somebody is asking for death, don't do it to them. And it's true. You see, what do doctors and nurses do? Doctors and nurses protect and preserve life. Your daughter protects and preserves life, and thank her for that. We're happy she studied to be a nurse, but she is caught into a system, and she has to do what she's told, or she's going to lose her job. And she's not allowed to think too much. And she'd say, oh, I think a lot. And I know how much they think. I've been a doctor for a long time, and I know about nurses, and any doctor who doesn't pay attention to the nurse, there's something wrong with him. Nurses tell the doctor almost everything if you pay attention to the nurse. So I always paid attention to the nurse. But I also know that I ran the ship. Yes, and the nurse is going to do what I said, but we all pulled together. Incidentally, we had, you hear of burnout that happens. Your daughter might tell you about certain people burn out in intensive care unit and that kind of thing. I've been the director of more than one intensive care unit, and we have had no burnout. Wow. No burnout. Why? Because we work hard, we study hard, we know what we can do, and we know what's beyond us. And you see, why do they burn out? Because they're being asked to do what they're not capable and don't need to do. You know, God takes care of things. We just have to do what we can. And so the system has to be where it's a system of protection of life. It cannot be an assisted death system. It cannot be a system that's based on palliative medicine and hospice and that kind of thing. And so we have to have that kind of system, and repeal Obamacare. Yes, repeal it, but replace it with a true patient protection, that it's a patient-oriented kind of care is what there must be. Then we will have something. And I would like to say this to Mr. Price or to President Trump, but there's no way to get to them. I'm too far away. I've done everything I can to get to them, but I can't get to them. But you see, miracles do happen, and not necessarily miracles, but some things are miraculous, like being in this beautiful church to talk. Did I answer? Oh, wait a minute, I got to answer the head transplant.
Oh, yeah.
The head transplant was done by Dr. White in Cleveland, and he did it on dogs, did it on monkeys. But it was a head transplant, not a brain transplant. That's the difference in that. And he has since died, but he said that they would do it on a human being before too long. That was several years ago. That they won't do it on a human being. I don't think they will. I mean, man does all kinds of things that he shouldn't do. But you see, a person is not divided above and below the neck. You know, it's convenient to separate it at the neck, but that's not how a person is made. The person is a unity of the spiritual and the physical. The spiritual is the soul is what we use for that. Incidentally, soul is a 4-letter word, so is life a 4-letter word, and they're interchangeable. When the soul is there, the life is there. When the life is there, the soul is there. They're interchangeable. And the life of the person is the substantial fact of the unity of the soul and the body. And the substantial fact, the substance isn't just physical. isn't just spiritual, but it's a unity of the soul and the body. It's the substance of the person. And the person is made in the image and likeness of God. And persons are different from other biological creatures. And you can't get around this by using words like biological beginning. No, doesn't mean there's not a biological beginning, but it's not a beginning. There are biological facts. The beginning is the creation by God, and you must stick with God, or eventually you're going to lose. And so you have to say, and so Life Guardian Foundation, you can look us up, www.lifeguardianfoundation.org, and you can see, maybe you'll see this presentation there, but you'll see other presentations that we've done, and the things that we've talked about are all there, and you'll find out how to get more of the books and more of the cards and other things, and then we do have this book that's here too, and Don asked for some more of these, and so we sent them this book, the Latin word or Italian word, Finis Vitae, and is brain death true death? Now, what is this? What's in this booklet? In that book, it's the presentations at the Pontifical Academy of Sciences. You have to put this into perspective. Pope John Paul II was concerned about brain death. And so he asked for the Pontifical Academy of Sciences to look at it again. And so the Pontifical Academy of Sciences brought together 6 people in support of brain death and 6 people who were in opposition to brain death, and I was one of them. There were also 6 who were invited to observe from each side. So there were 24 invited to present at the Pontifical Academy of Sciences. So we did those presentations, and then after the proceedings were put together, somebody high up in the Vatican wrote a letter, said, don't print it. So I went back to the Chancellor Serrando, who was the Chancellor of Pontifical Academy of Sciences, and he still is, to be sure. I communicated by email and other ways, and couldn't get him convinced to print it. So I went back to Rome so I could face him, see him face to face, tell him how important it was. And he said, I can't do it because they told me I can't. So what we then did is Roberto De Mattei, who was the director of the Italian Research Council, and myself, we put it together, and that's our booklet. It's the proceedings of the Pontifical Academy of Sciences in opposition to brain death. And this is the only place that you can get it, because they didn't print it, but we did print it. And so you can get it from us, and we asked for a small donation. You can have the book with the small donation. You say it's more than you can afford, you can have it anyway. And so if you'll read it, don't take it if you won't read it, but we want to read it. So head transplant, I don't think that's going to happen. I'm not optimistic about organs from pigs, but it gives research and spends money, and I'm not opposed to research, but it's the kind of research that's done on the beast. God gave us the beast to use in the right way, and so now, any other questions? Yes, sir. That won't stretch back there. Talk loud, maybe.
So some time ago, my mom got sick. She had a tumor in her brain. They took it out. She was fine in the recovery room, and then one of her veins burst, so she had an aneurysm. So then she was on a respirator.
Yeah.
And we asked, like, after a while, they did all kind of tests on her. She wasn't reacting, and they said there's no chance of her coming back, kind of thing. So I kind of consulted a priest I knew very well, and he says, you could take her off the respirator. That's what my sister and I did. So was there any hope for her, you think? I mean, back then, but we knew we took
So
the respirator.
your mom was on a ventilator, right? And you call it respirator, but it's on the ventilator. And it was helping sustain the life of your mom, right?
I assume, yeah.
Yes, right. And so they told you it's okay to stop it, and you did stop it. Right. Didn't take any organs.
Sorry?
Did not take any organs.
Didn't
No.
take any organs.
Oh, no.
No organs. So let's presume and assume that you did it in as good a conscience as you can, and we would say, okay, that's as good as you can do. I can tell you this much. I've taken care of thousands of babies on ventilators, and I've never stopped a ventilator. You don't have to stop it. If somebody has something really bad wrong with them, they're going to die. Might take a little longer, but that life belongs to them. It's between God and them. And one of the things I do, and I neglected to do it when I started here, I often remind people that I'm not talking about what they did or didn't do, that they did it as good as they could with the information that they have. But you need to learn more about it. I'm not saying that you didn't do the right thing with your mom. You did the right thing with your mom. But I'm saying that you have to learn about this, and then you have to teach people about the ventilator. The only thing the ventilator was doing for your mom was pushing the air in. Your mom did everything else to sustain her own life while she was on that. They took it away. Obviously, she needed that, but there's most patients are on a ventilator for even a few days. If it's very much longer than that, if you abruptly stop the ventilator, they won't breathe on their own. You have to wean them from it, and there's a way to do it if you want them to live. And there's other things you have to do to help them to live. And your mom had a serious problem with the brain tumor. How old was your mom?
67.
How many?
67.
70?
67.
67.
67. Okay. Well, anyway, and you have to know that the system is that when you get to be a certain age, whatever that is, but it's a lot younger than me, we'll just say 65, then you're not very worthwhile to society. I don't mean to disturb you at all about your mom. I don't mean that, and I certainly hope I'm not. Good. We can't bring your mom back to life. The only thing we can do is use that as an experience and use it to do a better job for all the rest of us.
Again, it was my decision, my sister's, but I also brought a very close friend of mine who's a priest, a Franciscan priest. I made sure, I said, look, based on what the doctors told us, is this morally right? And he said, yes.
Yes.
So maybe.
What do you say?
He sought advice from a priest.
Oh yes, advice from a priest. Here's what the first thing is.
He's a Franciscan
Yeah,
priest.
of course, the priests are very good men, and they are called. Priests are called, and priests are called. The bishops are called. Not the auxiliary bishops; they're appointed, but they're called, and so they certainly mean well. Most of the priests are not educated about these issues. Most do not know about it. They give answers, and they're as good as they can do, but most of the priests are not educated. So if you want to have some education, there's a booklet called Life, Support, and Death. And you can get it from American Life League. Judy Brown only charges $3. I wrote it along with 8 other physicians, and an attorney helped to put it together, and a Catholic priest. And so the teachings of the Catholic Church are very good, and they guide us, but the priests are not trained. The priests are all part. See, brain death is the root of much of the evil, and the teachers of the bishops are in support of brain death and organ transplants because it's big money. Okay, I don't mean to say that the bishops are paying attention to money, but if you take a stand against big money, then you might not get some more donations and stuff. I don't want to say that's it, but brain death is not true death. Everybody who is called brain dead is alive. So,
All right.
did I answer all your questions?
It's okay.
You can have another one.
I'll get you tomorrow.
What?
I'll get you tomorrow.
Tomorrow, you're going to be there. She's getting the tough ones for tomorrow. Okay.
Yeah. It's not a question. It's
Not quite dead yet?
no. It's not a question. It's just appreciation. Because I come from a country where we are considered overcrowded, and it's good for people to die and not to try and preserve life. So it's kind of hard most of the time to talk about brain dead and organ transplantation. So I very much appreciate this session being open for people who are not in the medical field as well. And I would definitely take your message back to India and kind of start.
What country are you from?
India.
India, yes. See, Indian people, very good people, I think. I have many good experiences with Indian people. Many of them have great faith. Mm-hmm. Mother Teresa had great faith, as an example that a lot of people know. But Yes, organ transplantation has to do with an affluent society. I read an article one time where 60% of medical school budgets revolve around organ transplantation. It's big business, and so if we disrupt this, we've disrupted a lot. But don't worry, folks. If you do what God wants you to do, God will find out something else for you to do. I have lots of examples of that, how God has done things to help us as we invented things to help babies. If you try to be with God, then even if you stop something else, God will give you something else that's better. But you have to stand with God.
Okay, I'm sorry. We have 10 minutes. Okay, 2 minutes more, and then we have to wrap up.
I just wanted to say, I believe that we are submitting to a moral relativism that is very...
Come here.
Oh, yeah. I believe we're submitting to a moral relativism...
Wait a minute. Come up here.
You can't hear.
Okay, now I don't hear well. Go ahead.
Yes, I think we're submitting to a moral relativism that is very similar to what happened in Germany.
Yes,
I just read recently in the New York Times, someone was in a coma for 2 years, and then they came out of it.
Yes.
Now, I don't think that that's going to be funded by anybody anymore. When my mother was in the hospital and she was passing away in the hospital, they had dozens of people in the waiting room. The hospital staff went around telling everybody to take them off of life support.
Yes.
They said, you have to do that. If somebody had a family member in a coma and they said, okay, I read in the newspaper someone came out after 2 years, I want them kept on life support for 2 years. I think they're going to hit the family with a bill for millions of dollars.
I'll answer that.
Now, I knew a guy who had some rare, generous medical care. He was on life support in a coma for 6 years.
Yeah.
He ultimately died.
Yeah.
But I don't think anybody's going to pay for that anymore, even though this country, I'll just mention this as a fact, we spend more on alcohol than education.
Yes.
We waste trillions of dollars, and yet I can't see how you could say that anybody on a coma could not come out after 2 or even 6 or 8 years.
Right.
So we're doing exactly what the Germans did.
We are. So you see, I basically agree with you. I will tell you about a man in Colorado who was in this coma for 7 years, and then they wanted to do something to his teeth, and they gave him Valium, and he woke up after 7 years. Now, so far as how it gets paid, that's where the force is, where it gets paid. That's where Obamacare, Medicare, Medicaid, single-payer system, all has to do with your treatment is going to be determined by how you get paid, how it gets paid. And I think that a doctor should not take money from anybody except his patient. And a doctor should only have a patient, and that relationship is special. Then, so far as getting paid is concerned, in Nevada, because we went with a patient by the name of Aiden Halou, a 20-year-old girl who had abdominal pain, and went in the hospital, and they operated on her, and her appendix was normal, but at the end of that procedure, she stopped breathing. And then they said she was brain dead. And so we went to the court and argued argued for her life, and the Supreme Court of Nevada heard us and gave us a unanimous ruling that what they had done did not show that this was true death. And so then what they did is they went back to the legislature, and the legislature has now put into effect in the law in Nevada is that if the relatives, they call it a surrogate, objects to their declaration of brain death, then the relatives may incur all the expenses involved at their continuing to sustain the organs. They don't say sustain the life, they crossed out life and make it sustain the organs. Not only that, they made it so that the relatives are not allowed to get information about the apnea test. It's written in there. The doctor does not have to give you any information. He can do that without information. And all of that is written into the law in Nevada. And you know what's going to happen? Every state is going to get that law. It's all going to happen unless what? Unless you, as a citizen, stand up for life. You must stand up for life, not simply being against abortion. Abortion is evil, and you should be against abortion, but you've got to be for life across the board. And you, me, all of us must do this. And where's the responsibility for it? It's on me for what I can do, but it's on you, too, for what you can do. And especially the young people must learn. Your life is in jeopardy. They want your organs, and they're going to get them. The way the law is that if you're unconscious and on a ventilator, they call the organ procurement people. They call them right from the emergency room. And I think right from the field, they already have it set up in the emergency room. They're going to call them as soon as the patient gets there. What hospital do you go to? If you're really sick and on a ventilator, really have a problem, they send you to the level 1 level 1 trauma center. The level 1 trauma center is the transplant center. It all fits into this thing. You must wake up. You must do something for yourself. You must be telling other people. Yes, we have those of us who are here. Who counts? God gets the people here who count. And so we have to do what we can to help ourselves and to help others. Thank you very much for paying attention.